Hello everyone, my name is Diana and today I will be talking about how the cognitive symptoms of dementia can be prevented, treated, and improved through a modified ketogenic diet with MCT supplementation and lifestyle modifications. This video is for practitioners looking to educate themselves on ways to treat patients with dementia so that they can help reduce the cognitive symptoms. This could also be useful for any patients that are looking to get better control of their own health, and of course for caretakers that are looking to see, okay, how can I better care for my loved one who is struggling with dementia. So let's get into it. So what is dementia? So essentially dementia is actually not a disease per se, rather it's a syndrome. And there are multiple diseases that fall under the category of dementia. Probably the most well-known disease is Alzheimer's disease. Overall, dementia essentially is a syndrome that causes rapid cognitive decline. There is no cure for it. And the risk factors include social isolation, physical inactivity, hypertension, diabetes, being overweight or obese, age, so 65 years or older. There is no known cure for dementia. However, research is thankfully showing that there could be a way of mitigating at least the cognitive symptoms involved with dementia. And that's what we're going to talk about today. The research is mostly about whether a ketogenic diet, which is a high-fat, low-carbohydrate diet, could improve the cognitive symptoms of dementia. And so I did vast research on different research papers and studies and review articles, and essentially the overarching consensus is that yes, the ketogenic diet does show that it can prevent, treat, and improve the cognitive symptoms with dementia. However, the downfall is that the ketogenic diet is extremely restrictive. 90% of energy in a ketogenic diet comes from fat. 90%, that's a lot. That's essentially the entire diet comes from fat, 7% from diet, and only a little bit of that comes from carbohydrates. So it's an ultra low carbohydrate diet. It's really difficult to adhere to a traditional ketogenic diet that is so low in carbohydrates, because really a normal diet for the typical person usually contains about 50% carbohydrates. Aside from it being really restrictive and difficult to follow, it also does have pretty harmful side effects. The ketogenic diet can only be maintained cyclically or in cycles, let's say. So it's not something that you want to be doing long-term because it can have adverse reactions. The most extreme side effects would probably be like malnutrition or dehydration. And the way to avoid that would be to employ a modified ketogenic diet. So a modified ketogenic diet, as I recommend for dementia, is plant-based, as in we are basing most of our meals on plants, right? And foods derived from plants. So most of the food consumed in this modified ketogenic diet is going to be from healthy fats. So we're talking about avocados, we're talking about almonds, olive oil, and then non-starchy vegetables. So broccoli, leafy greens, things that are really good in lowering inflammation. And then a tier above that, prebiotics, probiotics, and resistant starches. So this is like potatoes, artichokes, beans, also legumes. These are all in the next tier of the modified ketogenic diet. And then after that, we're gonna have moderate animal protein and fruits. Animal protein, of course, anything that comes from an animal, but we want it to be high quality. So this isn't just like throwing bacon on everything and calling it keto, absolutely not. Animal proteins that are rich in fats are okay, like for example, salmon and other fatty fish, that's fine. But in moderation. The difference with this modified ketogenic diet and a traditional ketogenic diet is that we're actually including quite a bit of carbohydrates in the diet, and we're also including quite a bit of healthy fats. This is what the modified ketogenic diet is for the recommendations to improve cognitive symptoms in dementia. Research is showing that dementia is actually essentially, they like to call it type 3 diabetes. What that means is that the brain loses the ability to metabolize glucose or carbohydrates as energy. And so the brain is unable to function properly. So what research is showing now is that if we increase the fat content, that means that ketone bodies, which are essentially the breakdown of fat, if ketone bodies enter the brain, then the brain is able to metabolize these ketones as energy and then therefore improve brain function. Okay, so that's kind of the basis behind the ketogenic diet and why research shows that it could be efficient and effective in improving the cognitive symptoms of dementia. Now you may be wondering, okay, well, if dementia means that there is so-called type 3 diabetes in the brain, which means that they cannot metabolize glucose for energy, then why would you still include carbs in the modified diet? So number one is that it's easier to follow. And number two, we're actually going to supplement this modified ketogenic diet with MCTs. Okay, MCTs are medium chain triglycerides. And this is a lipid or a fat that has a shorter chain and therefore is able to bypass the liver, so it's easily accessible to the brain, and it does not store as adipose tissue. It's kind of like the holy grail of fat. MCTs don't store as adipose tissue, unless of course we have an excess amount of it. MCTs have neuroprotective properties that help in the improvement of cognitive decline. Okay, they're easily accessible by the brain and the brain can use them as energy, which is essentially the problem with dementia. They can't use glucose as energy, so they use fat as energy. So the recommendation for dementia is we're going to employ a modified ketogenic diet. We're going to employ supplementation of MCTs. I also would recommend to improve certain lifestyle factors. Since lifestyle factors such as physical inactivity and social isolation can be risk factors for dementia, it is believed that by modifying those lifestyle factors, the symptoms of dementia can be improved. More specifically, the research shows that if a person with dementia does 2 to 3 days a week of 40 to 60 minutes of aerobic exercise, Tai Chi, resistance training, or mind-body practices, so that would be like yoga, they improve their cognitive function, and resistance training specifically has shown to be the most effective form of physical activity. One proposed mechanism suggests that social engagement can help reduce the cognitive symptoms of dementia because social engagement helps increase cognitive reserves. So cognitive reserves is pretty much like one's own ability to complete certain tasks with more resilience than other people. As social interactions increase, then cognitive reserves increase and therefore cognitive function overall increases. So that kind of concludes the lifestyle factors that I recommend should be modified in order to help mitigate the cognitive symptoms of dementia. More research is necessary in this space because the research that exists now is only testing full-on traditional ketogenic diet and its effect on dementia. However, like I mentioned earlier, that diet is extremely restricted and it has really negative side effects on people like malnutrition and dehydration. Due to those harmful side effects, it is beneficial to have more research that talks about a modified ketogenic diet. More research is also welcomed in the MCT space and how MCT specifically can help with ketone production in patients with dementia. And lastly, more research is needed to see how lifestyle factors affect patients with dementia. The research that we have now mostly shows how lifestyle factors can either increase or decrease the risk of in the future having dementia. But what we need to know is once a patient has dementia, what lifestyle modifications can be done to decrease the symptoms and to improve their quality of life overall. Although dementia is not a curable disease and it affects older population and is a syndrome that's growing in prevalence, the good news is that research is showing that diet and lifestyle changes can help improve cognitive function.